You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. Danielle, Drori, welcome to the Dr. Tyna Show. I'm excited to have you here today. We are going to talk about health sharing and coming in on the tail of a blog post I wrote recently that got a lot of attention. And so I'm really glad to have you on the show today.
I'm excited to be here. Thanks so much for having me.
Yeah. So you tell the audience about yourself and the company you work with and that we're going to be talking about today.
Yeah, so I work for Knew Health. It's KNEW Health, and I'm a membership specialist. So what I do is I speak to people every day and I help them figure out if our company suits their healthcare needs. So we are a health share. And, there's a lot of people out there who are paying a ton of money for health insurance and not really using much of it. So we give them an alternative. I answer questions, I onboard them, and I welcome them into our community.
Awesome. Okay. So the reason I brought you on today was because I feel strongly that a lot of people need to know that this option exists and also understand it clearly, because I didn't really know that it existed beyond hearing about it from a few friends here and there, like different Christian health shares.
Exactly.
And it kind of scared me. Like I don't know how to say it. I've always been a little bit of a nervous Nelly when it comes to health insurance, and my husband is the exact opposite. So
that's why you work so well together, right?
But he's a farmer and he's out there on the farm, like impaling himself and literally breaking bones. And he's just the craziest. And he is like, we don't need any of that. And so I was in this particular position. I'll back up. I want to share this with the audience. I never took health insurance as a clinician in my clinical practice. I did not accept health insurance. I was a payment at time of service clinic, and I still am. And the reason being was that I had a great mentor that I spent decades with in medicine. He was a phenomenal physician, and he explained to me how health insurance worked way back when. Prior to that, I had been a very sick child, like very sick. And I was born in 1974. So what I saw happen as somebody who went to the doctor all the time, I felt like my mom was literally dragging me to the doctor all the time, several times a week, at least, for different things, whether it was allergy shots or whatever. I was watching HMOs come in and watching doctors move into the hospital. And there, back in the day, I remember my mom being able to take me to a specialist, like an allergy specialist or some such doctor that you wouldn't normally think was affordable, and just being able to write a check, like normal blue collar family, write a check. And then it morphed. And suddenly we quit going to little clinics that were private clinics outside of a hospital. Next thing I know, we're going into the hospital to go into the clinic system there. And this went on and on and on. And this is really my origin story, maybe my villain story, villain origin story, because I decided I think I was 5 years old. I was being held down on a table by nurses and doctors while they were sticking some kind of vacuum thing up my sinuses to suck out the snot. And I remember thinking, like, there has to be a better way to do this. Like I vowed in that moment that I was going to be a better doctor than any of that nonsense. And so I have a really long history with medicine, not just being in it professionally, but being in it as a patient. And so health insurance has always been something to me that just got weirder and more complicated and weirder and more complicated. And when I was, as a young adult, I was a single mom. I was paying for my own health insurance in my, 20s and 30s. I was able to write a check. It was affordable. I think I was paying forever and ever. I was with the same company, and I was paying originally $79 a month. And then it went up to I think $179. By the time Obamacare came in, it was around $150 to $180 a month, I think. And I watched my premiums every year after that just jump. And then the deductible get really high too. And it was getting to a point where I'm a single mom. I'm trying to run a business. I'm trying to run my practice. I'm a doctor. I'm making decent money. the first few years of opening a practice are challenging and expensive. And I had no financial support. I was in bankruptcy at the time. So I was paying, every part of my clinic was built in cash. It was just money being reinvested back in until I had a beautiful, booming clinic. And I remember being so enraged at how my premiums kept jumping and how my deductible kept jumping. And it got to a point where year after year, I never got past the deductible. Like it never kicked in to give me actual care where they were paying for anything. And so, long story short, I end up with a basal cell carcinoma. And I also, 2 weeks prior to getting the diagnosis, like I literally went in and got the biopsy done. And prior to getting the results back, the company I was with, I shall not name names, but I had been with them forever, is my point. And they sent me a notice that my policy had been canceled. And I called and I was like, what's this about? And they said, well, you didn't pay your bill 2 months in a row. And I said, that's bullshit. It's being auto deducted from my bank account. I see the it's here. And they said, no, you didn't pay it in full. And what had happened was they raised the rates on me without telling me, or I hadn't gotten the notice, to $80 more a month. And for 2 months in a row, that $80 had not been paid. So I was $160 upside down with them and they canceled me. And I was like, you're kidding me, right? And they would not budge. And so I got the manager on the phone and like, I've never done that, let me talk to your manager before kind of thing. And I got the manager on the phone and I lost my mind on them. And they were like, sorry, no. And I was like, you guys are a criminal outfit. Like my mentor used to always say that health insurance was organized crime. And so I was like, yeah. And I let him have it. And then I get the results of the biopsy back and it's basal cell carcinoma and I need Mohs surgery. And it wasn't a big lesion. It was not a big deal, but it was at the time where like you couldn't enroll until it was November. Like it's so convoluted and messed up at this point. And I'm a grown adult and I can't even navigate it. And I'm like, so I have to wait till November to get my skin cancer taken off. Okay. So I had to wait 6 months for open enrollment and all of it. Right. And it's all such nonsense. And so years go by. And as I get older, I jump into the age cohort where premiums raise exponentially. And my husband and I never use the doctor. I am a doctor, so I take care of most of what we need. And I know not everybody has that luxury, but I make sure that we keep things really simple. And we rarely need medical care except for emergencies. And when I was the state I had just moved from, they did not allow us to buy only catastrophic care. So I was having to pay for these full bronze and silver policies. And by the time I dropped the health insurance last year, it was about this time last year, I think. Yeah, it was actually this time last year. I've been with you guys for a year now. My premiums were $1,500 a month for both my husband and I in exceptional health. Our blood work is exceptional. And our deductible was like $8,000. And it's like, what are you doing? Why are we paying for this? And I said, because what if there's an emergency? Like we're heading into heart attack age. And so anyway, I learned from another colleague, another naturopathic physician about New Health. And I was so excited when I signed up because I was so happy to drop my health insurance. I was so excited to join a health share. It makes sense to me. And once I got on the phone with your customer service is so just fantastic. I got on the call with somebody. They explained it all to me. And I realized like, oh, this is what I've been looking for. This is the kind of plan or whatever we call it. It's the kind of situation where when you take radical responsibility for your health,
yep,
you act. This is like the plan for those people.
Yeah,
and that's me and my husband. So anyway, long story short, that's how we got here.
Yeah, and unfortunately, you're not the only person that has a story like that, right? I mean, there's so many people who are also paying so much for something that they really don't ever end up using, or the doctors they want to use are not even accepted by their health insurance plan. So that's where we come in. So it really solves a lot of people's problems for sure.
Absolutely. And for people who, I don't like doctors. That's why I became one. I don't like going to the doctor. And I really want to have the autonomy to make the decisions I make. I mean, it's so crazy now. You could end up in a hospital and end up needing a specialist to come save your life or help you with a disfigurement or something, like because you had an accident, you you need your face sewn up or whatever. And that doctor might be in a hospital that your policy, or you're like on traditional health insurance, that your policy covers, like it's in network, but the doctor is not. Or the lab where they send your pap smear is not. Like, it's so crazy. And I don't know how anybody's putting up with it anymore. And so a health share plan like New Health, I think, is such a spectacular option for people who are, I would say, and I'm not advising anybody, but I would say, just looking at it objectively, when I saw it, I was like, oh, this is for healthy people who are taking good care of themselves. And I mean, really, at the end of the day, what we would end up paying out, you'll have to explain how it works in a minute, but what we would end up paying out is actually less than what my deductible was, if, push comes to shove. And so there's got to be some ability to, I would say in the past, there has to be some ability to come up with some money to pay for those situations, but really no, because all policies now seem to have a crazy deductible. So yeah, for those who have a healthy family, I think it's a wonderful idea too. That's who originally told me about it, was somebody with a ton of kids. And I was like, how are you? And and I will say this, entrepreneurs, I got a lot of messages after I launched that blog post from entrepreneurs, people who were either planning on leaving their corporate jobs and going into entrepreneurship. A lot of people don't leave their jobs and really pursue entrepreneurship, even though their heart's calling to them, especially at this age, my age, of like in your 50s, when you're just done working for somebody else and you're like, I'm going to go try my hand at whatever. And one of the big reasons I hear people say or talk themselves out of it is because, oh, well, I'll lose my coverage. And so
crazy? They're not following their dreams because of healthcare. They're letting their health insurance hold them back from following their dreams.
People stay at jobs all the time, because I'm in the influencer online space. So I talk to a lot of people who are kind of on the in-between, where they've built up their following to the point where they really could leave their job and they don't want to because they're worried about coverage for their family. And I'm like, dude, I got a solution for you because this is really, I think, really reasonable. And people get so excited. I got a lot of messages from people saying, I'm so excited that you mentioned this, that you shared about this, because now I feel comfortable doing that. So, which like warms my heart, because I love a good entrepreneur. So anyway, okay. So what is health sharing? So people understand.
Absolutely. Yeah. So health sharing, the whole concept is really where each month our members contribute a set amount, which goes into a community fund. And then when someone from the community has a medical need, it's paid for through the fund. So the concept's been around, I would say, for over 40 plus years, but it has always been very popular with a lot of religious communities. So I know you mentioned that a little bit earlier. Most other health shares are religious based. So a lot of them will have someone take like an oath of Christianity, for example, whereas we are not religious based. So we're inclusive. That's something that sets us apart. Because we're not health insurance, we don't have any network restrictions. So our members can see any doctor anywhere, whether they're alternative, like a functional medicine doctor, or a traditional MD. So we always leave it up to them to decide on their care.
I love that. I love all of that. Although I am a Christian, but I wasn't before. And that's probably one of the things that scared me off before from the health sharing plans, was I was like, I don't know about this. This seems a little cultish.
Yeah.
I didn't know. I didn't understand it. So I, was just being judgy. But yeah. No, I really like that about New Health. And then explain how this works. So there's the, I forget what it is, but it's the amounts that so what I did is I went in and I chose my plan based on what is the IUA?
Yes. So when someone enrolls, they're going to choose something called an initial unshareable amount. We call it an IUA. So the IUA is the amount that you are responsible for paying for each new medical condition that occurs. So each new illness or injury that occurs. And then whatever amount is beyond that for that particular medical condition is what New Health will share in or pay for. We have three options that people can choose from. There's $5,000, $2,500, and $1,000. The lower the IUA that you choose, the higher your monthly contribution is going to be. But you also want to keep in mind that you won't be responsible for more than 3 IUAs per family per membership year. So 3 things could happen to you and you pay an IUA for each of them. And then if one thing happens to your husband, you don't pay an IUA for his illness because you already paid 3 for your really bad year that you just had.
Oh, okay. So that's 3 for not per individual, but per family?
Per family. You got it.
Oh, wonderful.
Yeah, exactly.
Okay.
Exactly.
So say he impales himself on the farm.
Yep.
We're responsible for that IUA, which is that initial shared amount.
So let's say it's $1,000. You would only be responsible for $1,000. And then he falls off a ladder.
That's separate.
Separate, right. Then he impales himself again. That's another one. And then you fall off your bike. That's the 4th one for the family. So you're not going to pay an IUA for your injury because you already paid 3 of them for his really unlucky year that he just had.
Really unlucky year. I like that. That should be the name of a book. Ryan's really unlucky year.
There you go.
No, we want all the luck in the world. He's doing great. No, but so now what I understood when I talked to your member, who was Nicole, she was wonderful.
Yeah.
She explained it to me that, like, say that first impalement led to complications down the way, and we had reached our IUA amount. Anything past that, you guys would
correct
take care of.
Yeah. So it's also very different from a deductible with insurance because a deductible resets every calendar year, but an IUA never resets for a medical condition until you're symptom free for a year. So if you do develop something that takes maybe several years to heal, you're only paying 1 IUA until you're symptom free for a year.
Amazing. So say, God forbid, like cancer or something like that, and you're looking at several years of care. That's awesome. That's really awesome.
Exactly.
Okay. I love that. Now, what about the only other thing that I really cared about at the time was when I signed up was emergency visits. Explain how that works.
Same
you end up needing to go to the ER.
So this is exactly where your IUA comes in. So anytime you speak with a provider or a hospital and they ask you for your insurance, you always just tell them, I don't have insurance, I'm self-pay. And they're always going to give you, usually they do give you some sort of a discount for being self-pay. So in the case of an emergency, you're just going to go to the ER, you tell them you're self-pay, and then they'll just mail you your bill. So what's really nice is that when you get that bill in the mail, you no longer have to hold your breath and before you open it to think, what's this going to be? How much am I going to owe? Was this an in-network or out-of-network hospital? You have the peace of mind knowing that, okay, I only pay my IUA. That's all it is that I'm going to owe. So let's say you open the bill and it's a $40,000 bill. You would just submit that to us. You're going to have a portal that you log into. You just upload it into your portal. Now, what we do from there is we actually go through the bill with the fine-tooth comb and we find all of the billing errors on them first. I don't know if you know this, but I read a statistic a couple weeks ago that said 83% of medical bills have an error on them. Yep. So we find them. And on top of that, we also attempt to negotiate with the hospital on your behalf to get that bill lowered. So on average, we lower bills by up to 46%. So let's say we drop your bill down to $20,000. At this point, you just pay the hospital your IUA. If it's $1,000, you pay $1,000. And then we send you a check for the remaining $19,000 so that you can then pay the rest of that bill. And then if you need a follow-up appointment with your doctor, we'll also send you a check for that because it's all related to that incident.
That's awesome.
Yeah.
Yeah. That's really awesome. That brings anxiety way down because people don't understand the racket with billing. And I'll explain it really quickly. This is how it works. And this is why I refuse to take it in my clinic. For one, health insurance dictates what I can and cannot do with my patients and how I can and cannot treat my patients. So that right there, it's out. I'm not doing it. Second of all, there's 3 different rates. There's the self-pay rate. There's for instance, how do I explain this so it makes sense? And because people don't ever really realize this. If I were to go through like an MRI facility and get an MRI and there's the cash pay rate, if I say I'm uninsured, that's maybe let's say $500. And then there's the insurance rate, which is a rate that they have already pre-negotiated with the insurance company. However, they bill an exorbitant amount, and then the insurance company says, we're only going to pay this much. And then the rest of that balance is due back on the patient. And it's insane because I've had this happen where I had insurance. I just had this happen at the dermatologist before I moved to Arizona. I had insurance. I told them I had insurance, but when I walked in, I said, I want to do self-pay. Because I knew I knew at the end of the day it was going to be less. My husband had actually just had the same exact procedure done. And so it was just a little biopsy to check on a skin lesion. And so I'd already gotten the bill. I already knew what to expect. And I said, I want to do self-pay. And she said, are you sure it's this much? I said, that's less than my husband's bill was. So yes, I am sure. And so I did. They still ended up billing my insurance, even though I specifically told them not to. And anyway, it was a whole big convoluted mess. And at the end of the day, I'm like, dude, I'm on to you. I'm on to all of this. I know how this works. I'm a doctor. I've seen it in action. It's not cool. And there's just no part of that I want to participate in. That's why I, A, refused to take health insurance in my clinic. And B, I actually went a long period of time without any health insurance on myself. I had my daughter covered, but I did not have myself covered because I'm like, I'm not participating in this. But then I got old enough and I realized I wanted coverage just for peace of mind. But it's just, it's bonkers. And then if you look at like, just totally off topic, but since we're talking about this, for specialty lab kits, like say your naturopathic doctor wants to hand you a kit to take home to test your saliva or your stool or your urine or something like that. There are 3 different prices. There's the self-pay, there's the doctor rate, which is more than the self-pay. It's a little bit. The doctor can bump up the price a bit because they're going to interpret it. It's for their time, interpretation, explaining it to you, et cetera, which is fair and legal. And then there's an insurance price if they were to bill insurance. So the same thing with blood work. We go through, I've always had a lab co-op or some kind of, it's much more common now that you can find it. But back then I made sure my patients, they were getting like, if they went through their insurance, it would have been $2,000 to $2,500 for the full panel I wanted to run. With my co-op, it was about $250. But when they went with the $250, they agreed that they could not submit that to their insurance for reimbursement. Like that was, it's over. Like you're paying the $250 and it's over, but it's just such an absolute racket how the system runs, in my opinion. And I did not want to participate in that. So,
well, I think health insurance in the healthcare system is one of the only industries that really doesn't provide price transparency right away for most people for things, right? A lot of people, just walk into the doctor's office. They have no idea what the bill is going to be. But if you were to go to a grocery store, you would never just say, hey, just send me the bill. Who cares what it's going to be? I'll pay it later down the road. Like, no, you know exactly what you're paying for and how much it's going to cost. So I think that's one of the benefits of having New Health is that you have price transparency for everything. So in the situation of, let's say you do need an X-ray or an MRI, CAT scan, mammogram, colonoscopy, we actually have a medical concierge that you can reach out to, and we can help you find all of those things at the most affordable locations. So you'll know exactly what the price is going to be. If you ever need a surgery ahead of time, you can also ask your doctor and hospital for a quote, and they legally have to provide it to you. And then you can submit that to us and we'll just let you know if you're actually getting a fair and reasonable price. And if you're not, we would attempt to negotiate it for you ahead of time or even help you get a second opinion elsewhere. So there's just so much effort for the community with helping keep those costs as low as possible. And we actually have not raised our monthly rates in a little over 8 years. So because of everyone's efforts, it's truly working for the community.
No, it's awesome. I remember talking with you guys about that and learning that there's even different websites you can go to where you can find the cash pay price on different procedures, like a colonoscopy, for example. And you have that all inside the portal. I was so impressed because I was like, this is what I wanted to provide my patients. Like so many of the resources you guys provide us as New Health members, I was like, this is the kind of thing I wish existed when I was in the thick of it in my busy practice, because it's insane what the difference can be. I went to the dermatologist the other day here in Arizona. I'll tell you, way more efficient. There must be a much bigger demand for dermatology here, I'm assuming because of the sun, but man, they were efficient. And I walk in, I tell them I'm self-pay. They tell me exactly how much the visit's going to be. Everything's transparent. I've been in other clinics in Oregon where I asked what the price was going to be. And they're like, we don't have anyone ever ask that. We don't know. I mean, this was back when people generally had more coverage. They couldn't even answer me. It was crazy. So anyway, they were very efficient here. And then as I walked out, the nurse came up to me and she said, since you're self-pay, you sign this form. There's some federal, I don't know if you know this, and I didn't get a copy of the form, although I could. There was some kind of federal thing where the biopsy, the lab could only charge up to $75 if I signed this form instead of whatever amount they wanted to charge me. So she hands me these 2 forms, one for each one of my biopsies. I signed them and I was like, that's awesome. Like it was actually more efficient being self-pay in the, inside that office who actually, they knew what they were doing. But I was like, man, this is how it should be, because at the end of the day, I had a patient once who demanded that I bill her insurance. And I said, okay, fine. So what I did was I billed her insurance for every single thing I did. And we weren't doing, a lot of what I did was regenerative injection therapies. And there's not even a CPT code for most of those or ICD-9 code. So, or ICD-10, I guess is what it is now. But I made her a spreadsheet and I put down every single thing I would have billed or charged her at the time and had payment at time of service on one side of the spreadsheet. And on the other side of the spreadsheet, I did the breakdown of the whole process with the insurance company. And at the end of the day, I made less and she got charged a bunch more when we went through the insurance. And it was a huge headache for me. And I was like, okay, so there's your proof. And I'm never doing this again. I'm never playing this game again, because I have seen my mentor's practice. He had the most amazing cash pay practice. He ran 4 rooms at a time. He was extremely efficient. The patients loved him. The care was excellent. And then I worked for this guy for 20 years. And then I watched him bring in health insurance in the 90s. And I watched the entire patient base change with that, because suddenly they could get naturopathic care with their health insurance. Suddenly compliance went down. People were no-showing for their appointments. I mean, it was like an entirely different kind of patient base. It was very interesting. And then I left the practice for a while, came back years later. I would work for him on and off throughout those 20 years. Come back in, and at this point, he's got a full-time billing specialist. She's getting paid a clip just to literally do billing all day long. That's all she does. He's got all insurance-based patients, and he's got an accounts receivable, in the 6 figures. And I'm like, this is bullshit. Because he brought me back in as the office manager. And I'm like, this is bullshit. This is not efficient. You're not making more money. At the end of the day, like, I remember when you were making more money 10 years ago. Like, this is not cool. And so, and he, his rates were very reasonable when he was cash pay. So anyway, he writes off I think we wrote off like close to 6 figures that year in accounts receivable of money he just was never going to see. And I was like, I am never doing this.
Right. Which is why doctors offer the discount for being self-pay, because they get paid way quicker the day of. They don't have to worry about that accounts receivable. So it's worth it to them. And that's why, self-pay gets such better rates a lot of the time as well.
Yes. Yes. So my pearl here is, if you have insurance, I always would tell my patients, tell them you're self-pay, get the self-pay rate, pay the bill, and submit that to your insurance. You submit the super bill to your insurance. And at the end of the day, you'll probably pay less than if you, and this is not, don't go do that and come back on me if the listeners are listening and think that, but I'm just saying, in general, it ended up being less than if.
Well, first they want to drop the insurance and come over to New Health and then say you're self-pay, because they're going to save even more money because they won't be paying those high monthly premiums. So
yes.
That's absolutely a better step.
I love that. No, that's a much better idea. Because when people find out that they can get an MRI for like $500, they're
even less. Yeah, absolutely.
Oh yeah, less now.
I think people just assume that things are thousands of dollars because they're used to seeing the statements that come in from their health insurance of what it started as. But little do they know that it's inflated when it starts out with the insurance company, and it's way, way less for self-pay. Absolutely.
And I love that you guys are in our corner to help negotiate those down, because that is huge. That's
who wants to spend the day on the phone arguing with someone? We have a team that handles all of that for you. And I know you mentioned the customer service when we first started, but We are known for our customer service. So anytime you have a question about something, you can call, you can email, you can hop on chat. If you call in multiple times, we try and have you speak to the same person so you're not repeating yourself. You'll never reach a random call center. You'll always speak to a human. So it's a very different experience from when you call into your health insurance company, for sure.
Yes. You guys have been awesome and I haven't needed, knock on wood, I haven't needed anything, but when I have inquired, like my daughter just signed up, we got her signed up, which I'm really excited about because we moved her out of Oregon and then she didn't have any coverage. And that's the other thing. The health sharing is enacted regardless of where we are, correct?
Correct. So with your health insurance, you're very limited to the providers in your state. Because we are not health insurance, you can see any doctor in any state. For people who live very close to another state and wanted to see a doctor that's maybe 15 minutes away in another state, they couldn't do that before. But with us, you can see any doctor in any state. And if you're traveling international and something happens while you're abroad, it's the same as in the US. You would only be responsible for your IUA and we would share in the remaining bills.
I love that. Yeah, because I go back and forth from Oregon to Arizona and I'm predominantly in Arizona, but I do spend a month or two in Oregon. And I was like, what am I going to do? Before I was like, I found you guys right before, it was right when I was in the middle of purging and packing my life to move to Arizona. And I was so nervous about that. And I know you said right now, specifically Oregon isn't part of this right now, but at the time I was like, at least I have, a little bit of wiggle room there. So, and then my daughter, we signed her up and she was excited because she has put off a lot of things because she wasn't sure how to navigate her health insurance. I was trying to help her, but there's this time period where your kids are no longer children, they're adults, and you can't make phone calls for them and they don't know how to navigate things. And so they just don't, or they navigate it poorly. And so I see a lot of young people get kind of mixed up in the system when they're trying to navigate their health insurance and coming up with crazy bills. And that part's really frustrating for me is, you've got a 20-year-old or a 25-year-old and they're just trying to figure out. So I was like, just sign up with New Health and it's clear. It's just,
it's clear. We'll help her navigate everything. So it's definitely, but yeah, especially with preventative care, that's a huge, huge part of our membership as well. So, with most health shares, they actually don't share in preventative care. So most health shares will only be there for the big type of things like the illnesses, the injuries, or there's a wait period for them to share in preventative care, or it's a very small amount. With us, as soon as the membership begins, we give everyone several allowances for different preventative health services that we just reimburse them for up to the allowance amount. So everyone gets an allowance for an annual physical. For children and babies, we follow the standard schedule of wellness checks. So we reimburse for each of them. We do another one for a well woman exam and pap smear, one for a mammogram or thermogram, one for a colonoscopy, any immunizations people choose to do, STD testing, and birth control. So they can start making those appointments on day one without ever having to pay an IUA. So let's say they want to go for a physical, right? It's a $250 allowance. So all they have to do is make the appointment with their doctor. When they ask, is there a change in your insurance? You say, I no longer have insurance. I'm self-pay. The day of the physical, they pay for it. They just reach out to the billing department to get an itemized receipt, upload it to us. And within a couple days, we reimburse them up to $250 since that's the allowance amount for a physical.
I love that. I think that's genius. That's what my daughter was excited about because she was able then to, it's funny. She realized, she's like, Mom, I'd never taken her to see a medical doctor until she was, gosh, I don't know. I think the first time she saw a medical doctor, she was in the ER, I think. And she was an adult because between me and my colleagues and my mentor and everyone else, like she always had care, and then suddenly she found herself in her 20s wanting to be more autonomous and was trying to just navigate some of these things and not have to tell me everything, right? All the private details that are none of my business. And it was frustrating for her. So when she sat down for the onboarding call with you guys, she was like really excited when she got off the call. She was like, oh, this makes sense, just go in the portal, figure it out, and call them if I need them. So,
and another big thing we do for preventative care is blood work. I know you brought up blood work a little while ago with, the pricing that you've seen and the differences for it. So, blood work is one of the most overcharged aspects of healthcare. So what we do to help keep those costs down is we actually have our members order their own blood work through a company we've partnered with. The company's called Evexia Diagnostics. And Evexia would simply just send you to your local LabCorp to have your blood drawn at the lab. We give our members some panels for free. So typically the most common ones that a doctor wants at a physical are the CBC, the metabolic panel, and insulin. So our members can order those 3 for free anytime they want, as many times as they want from Evexia. And then everything else is wholesale priced. So they're going to find labs for $4, $8. A thyroid panel that I ordered was $15. So super inexpensive. And they don't need a doctor's order. They can order anything they're curious about anytime. They get the results directly. And then we reimburse each person up to $80 a year for any blood work that they choose to do. But given the wholesale pricing, the 80 ends up going a really long way for most people. So that's a huge tool that we provide to everyone, and they absolutely love it. It really puts your health back in your hands because you can order whatever you're curious about.
Yes, and that's the key, is letting people know that they can be empowered to take their health back into their hands. That's so huge, and it's something that's sorely missing from our current medical model. Mm-hmm. And health insurance just creates, it's so bizarre when people used to get really mad at me for not taking health insurance. And I was like, do you expect a third party to dictate and decide what they're going to cover with your car? Exactly. I'm not talking your car insurance. I'm talking just for maintenance of a car, just basic, oil changes, tire rotations, etc. That's just not how it works. And now we are seeing this model come into some different industries as of late, but at that point, health insurance was the only thing where you're just kind of guessing. And even then you call them and you ask them if you have coverage for a thing you're going to go do. And they're like, well, this isn't a guarantee of coverage. And I'm like, well, then why am I on the phone with you? Why am I paying you? What's going on here? You know?
Right.
It's crazy. It's crazy. I once, and this has nothing to do with you guys, I'm just sharing this. I once was at a dinner event with a bunch of people I'd never met. It was my friend's birthday, and we were all at a restaurant. And I ended up sitting next to this lovely woman who was a claims adjuster for a health insurance company. And she literally told me this. She said, my boss will come into my office because she was drinking and she wasn't much of a drinker. So she was 2 glasses in and suddenly they start spilling the beans. And I was taking advantage of the situation because I was like, tell me everything I need to know, because I think insurance is such it's a racket. And she said that her boss would come into her office and literally just take the pile and throw it in the garbage can. If the pile got too big, they would just swoop it into the garbage can and move on forward, which I'm going to assume that was true because it came out of it was a first person who worked, and I was like, that's the nail in the coffin. I'm definitely not taking insurance. Wow. I couldn't believe that. So I don't know, I'm not saying that's the policy everywhere, but I just thought, wow, what a fiasco. Here's an example. What about somebody who, first of all, explain pre-existing conditions and what your guys' policy is on that. And then I'll ask the question.
So we consider a pre-existing condition anything from the last 2 years that you've either had signs or symptoms of, or have been diagnosed with, or treating or taking medication for. In which case, if something is needed for that condition in year 1, it's not shareable. In year 2, we can share up to $25,000 for it. In year 3, up to $50,000 for it. And then in year 4 and beyond, $125,000 a year for that condition. Now, there are 3 exceptions that we do make. They are high blood pressure, high cholesterol, and diabetes. So as long as you have not been hospitalized in the last year for any of those 3 conditions, and you're just maintaining with maybe diet or medication, you don't have to worry about those being listed as pre-existing. We don't count those in the category.
Awesome. Okay. So what if somebody comes in with, well, like, let's say me, this is a good example. I have had a couple little basal cell carcinomas over the years, and they were all in different places. So if I come in, and I would assume that's a pre-existing condition. So any basal cell carcinoma past or beyond is probably considered a pre-existing condition. Am I right?
So we would always turn to your medical providers to make the determination if something is related to a pre-existing condition. So for something like skin cancer, if it pops up in one place and then pops up in another place, it might not necessarily be related. So we'll always just turn to your medical providers to make that determination. But I think a better example is more so, let's say you've had a giant growth on your neck, right? The size of a softball that you never went to get checked out. And then you join and you decide to then go get it checked out and want to get it removed. Well, even though you never did your due diligence to get it checked out, we're going to see in the medical records that your doctor is going to write has most likely had this growing for at least 6 months to a year, given the size of it. So that's something we wouldn't share in the removal of because it's already been there. The signs and symptoms were there.
Gotcha. Now, what if that turned out to be some kind of metastatic cancer? Is that all under part of that?
Correct. Right. So It's as part of that because the sign, the symptom was there and you just decided to ignore it, right? It was already there within the 2 years before you joined. If that did turn into something in year 1, we wouldn't share in it.
Got it. Okay. Very good. Well, that kind of answers my question then, because sometimes things show up as one thing and then years later they end up being something else. And so determining it based on what the doctor says, I think that's very fair.
Yes. And it also has to be observable signs and symptoms, right? It's so if you develop something and there was like no symptom there in the last 2 years, that's a little bit different than if you're ignoring the giant growth or if there's been blood in your urine the past year and you haven't told anyone about it, right? That's you ignoring a symptom that's been there. So, and we're not asking people to list, when they had strep throat, last or anything small like that. It's more so if you've maybe had your knee swelling with pain the last 6 months and you haven't gone to get that checked out, that would be pre-existing.
Yes.
So I think for most people, who join, they're not typically, joining with a ton of these conditions because truly, if you have a lot of those conditions, that's who health insurance is more for because they're going to be needing it and using it with various specialists and doctors. But for someone who doesn't have these conditions or maybe has something that's very treatable, like a thyroid condition, for example, that's someone who we typically have in our membership because a thyroid condition is very manageable, especially with Avexia, running their own blood work, something more along those lines.
Got it. Okay. Yeah. Good to know. And then what about like little things like rashes or something simple like that?
Yeah. And just back with pre-existing, if anyone does have any questions about anything they've been dealing with, we always tell people just call us and we will be happy to walk you through if this is a good fit for you and the conditions that you have. We would never want to see someone join the community who this isn't a good fit for because we do want you to have the best help for your health. So absolutely reach out to us if you have any questions with any conditions or signs or symptoms. But yes, so for something more acute, right? Like let's say someone wakes up with a fever or a rash. So instead of just running to urgent care or the doctor's office, we suggest you start with telehealth and we can reimburse you for telehealth as many times as you need it. And we let you decide on the telehealth provider. So we're going to give you a couple of websites is in your portal that you can choose from. But if you've used a telehealth website that you love, or if you know of a doctor that does telehealth, you can use them and we reimburse you for that as many times as you need it.
I love that. That's so easy. That makes it so easy. And now is that subject to the IUA?
It is not. No. So day 1 of the membership, you wake up with a high fever and you want to speak to a doctor, you can absolutely hop on telehealth, submit the receipt, and we reimburse you in just a couple of days for that.
Amazing. Yeah, I heard also from you guys that usually reimbursements happen pretty fast in general.
Super quick, super quick. So you can expect a check in about 1 to 2 weeks, or you can even set up direct deposit. That goes through in just a couple of days. So we're very fast with that. Unfortunately, there have been some nightmare stories from other health shares where it takes months for them to pay out, sometimes even years. But we are super quick. We've actually never had a member ever go into collections on account of waiting on payment from us. And we've shared in 100% of the eligible needs that have been submitted.
That's awesome. Yeah, that's big. That's a big one. I have heard some horror stories from friends, and I was like, oh, that was the other reason I was scared of health sharing, because different situations I'd heard of. Health coaching too. There's something about health coaching in there.
So each member receives 2 free health coaching sessions each year. The founder of New Health is actually, his name is Joshua Rosenthal, and he started the Institute for Integrative Nutrition. It's the world's largest holistic nutrition school. So they train people to become health coaches. He actually started the whole health coaching industry.
I had no idea. I put my husband through that program.
Oh, yeah. Yep, absolutely. So he started IIN way back when, over 30 years ago. There's over 155,000 graduates in nearly 180 countries now. So it's become a huge phenomenon. But he always thought that the healthcare system was broken. And so after he sold the school, he decided that his next venture was going to be in healthcare and helping people at an even bigger level. So that's where New Health was actually born from. But because he's, of course, the founder of health coaching, we give our members 2 free health coaching sessions each year. And our coaches can take a look at what you're eating and your lifestyle and just make some small suggestions that might go a really long way. So they get access to that every year.
That's awesome. That's a good place to start. And there's a credit you get back too if you submit for like gym membership, or
yes, everyone loves their self-care credit. So
that's what it is.
We give each membership a $200 self-care credit to use each year. So this is the only preventative allowance that a family would share if it's more than one person on the membership, whereas all the other allowances I mentioned earlier for preventative care is per person. But this one people love because they can basically use it for anything self-care related. So you can submit receipts for the chiropractor, for a massage, gym membership, vitamins, supplements, acupuncture. If you happen to order a ton of blood work and it goes beyond the 80, you can use your self-care credit for the remainder of it. So it's totally up to you how you want to utilize it. It's just a nice little $200 bonus that you get back for anything self-care related.
That's great. Yeah, I love that. And then maternity and home birth. Tell me about that, because that's a big one for a lot of the people who follow me.
Yes. So we share in everything from your prenatal visits, ultrasounds, blood work, whether you do choose to home birth with a midwife or a birthing center or a hospital, your postnatal visit, the baby's wellness while they're in the hospital. We also share in pelvic floor therapy, chiropractic care, and postpartum depression counseling as well. Now, the only difference between maternity and having an illness or an injury is that regardless of the IUA you're enrolled with, everything related to pregnancy is a $5,000 IUA instead. So you would be responsible for $5,000 and New Health would share in all the remaining bills. There is a wait period for maternity. So your estimated due date has to be in the second year of membership. So it doesn't mean you have to wait until year 2 to become pregnant. It basically means you have to wait at least 90 days to conceive from when the membership begins, which would then put the due date into year 2. But once you find out you're pregnant, we always encourage you, as soon as you find out, hop into your portal. You can actually schedule a maternity welcome call with our team. And we are going to walk you through step by step what to tell your providers, what to ask of them, what to submit, when to pay things. We really want this to be a stress-free time for you. So you're going to know step by step what to do and when to do it. So it's all going to be very clear.
That's so huge. When I was pregnant, I was married and my husband kept getting different jobs. And so I was very young and we were broke. And I had to keep paying the deductible over and over and over with the three different insurance. By the time it was all said and done, I had paid a fortune to have my daughter, and it was crazy.
What people don't realize is a lot of times, depending on when your baby is born, you might be paying two deductibles, right? Because like my last child was born in February. So I had to hit the deductible the year before. And then I also had to hit it again when I had her. So it was just, I couldn't believe the bill that I received. But with us, it's just the $5,000 and that's it. You know, like that's all you're paying regardless of when you're having that baby. Of course, as long as it fits in the estimated due date, the second year. But yes, regardless of the calendar, you're only going to pay the $5,000.
That's huge. Yeah, you make a good point there. What about if the baby ends up in the NICU or something like that? How does that work?
So now this becomes a need for the baby. So now it would be an IUA for the baby's health, which reverts back to whichever IUA you chose when you enrolled. So if you enrolled with the $1,000 IUA, then for the baby stay in the NICU, you would be responsible for $1,000 and whatever other care they needed, and we would share in all the remaining bills.
Amazing. Okay, that's very clear. That's helpful. And then the last question was about, I know a lot of people are going to ask about alternative care. I hate that word, but naturopathic doctors, chiropractors, you mentioned acupuncturists. How does that work within this?
Well, that's another reason why our members absolutely love the membership. You know, you can see any doctor anywhere. And if you ever have an illness where you want to seek out some sort of alternative treatment, you just have to fill out an alternative treatment plan, which is going to outline the benefits of the treatment, the cost of the treatment. We might ask for the medical records and we approve them on a case-by-case basis, in which case, if it's approved, you're only paying your IUA and we share beyond that. So it's something very different because insurance won't pay for alternative treatments. Most other health shares won't either. So it's another aspect of the membership that also makes it very unique.
When Obamacare came in, the naturopathic doctors were so excited and they thought for sure that they were going to be included in all of it and pay parity and all the things. They were going to, not only were they going to get coverage for their patients, all the insurances were going to take naturopathic care was the promise, when it came in, and everybody was so excited. And I was over there going, this is a bunch of bullshit. The premiums are going to go up. We're still not going to be included. Trust me. And my profession, the backlash on me from my profession was so intense because I was constantly angry about it on Facebook, and they were constantly coming at me being like, this is good for us in the end, and it's good for our patients because patients will have access. And here we are, however many decades later, and the naturopaths are not in a good position with insurance at all. The pay parity is not there. They are getting paid peanuts compared to their MD colleagues if they get coverage at all. And most of these, what I have seen in my own policies that I have been, my own personal policies as a insurance buyer, was that each year the alternative benefits became less and less and less and less and less, and less was included. So it didn't pan out. No, it just didn't pan out. Sure. So this is a very clear cut, and I think it's very fair and it's straightforward.
Yes.
And that's exactly what I'm looking for.
Yeah, we have to make sure that you're not like the guinea pig for a certain type of treatment, right?
Sure.
Because that's something we wouldn't be able to share in. But if there's proven efficacy, and if the pricing, which actually a lot of alternative treatments turn out to be less expensive than going, the medical traditional route. So as long as it all aligns, then we would approve something like that.
Yes.
Yes. And then something else we have an amazing partnership with a company that gives you 35% off of vitamins and supplements. They have all the highest quality brands. So our members absolutely love that. It saves them a ton of money if you're into vitamins and supplements, which I know many of your listeners are. And then we also give our members a Fit On membership. So Fit On is an amazing health and wellness app. It gives our members daily access to all sorts of premium like workouts, meditation classes, yoga, nutrition programs. So something we're really trying to do is create this membership that people actually use on a daily basis, not just when an emergency comes up. So it's something that we're striving to actually do is make it something people use and are enjoying for sure.
Yeah, once I got into the portal and saw everything, I was very impressed. I was like, there's a lot here. Like, you guys are really trying. Well, it makes sense who the founder is then, because you guys are really trying to help people not only become healthy, but become autonomous and take responsibility for their own healthcare, which is my whole jam. Like, that's literally my entire platform. That's why I do this. That's why I have this podcast, is 100%. So people have enough knowledge so that they can go make sound decisions in their healthcare and not just be sort of, I mean, the days of, the doctor being God and you doing whatever they say. And then that was usurped by the insurance companies being God, and you basically had to do whatever they say. And I'm just not down with any of that. So I was glad to find you guys. And I think what the way you lay it out, it's very reasonable. It's very fair. The pricing is very fair. And really, again, I would say 5 years ago, maybe 10 years ago, I would say, oh, maybe this isn't for everyone. But with the insurance rates being what they are currently, very fair pricing, very reasonable.
Yeah. Yeah. And we don't have an open enrollment period. People can enroll anytime they want. The membership always starts the first of the following month. So if you're enrolling in, let's say, June, it's going to start July 1st. We don't have a very difficult application process. It's super quick. They just enroll on the website. It takes maybe 5 or 10 minutes. We don't require a physical or anything like that. And then as soon as they enroll, they get an email with their login information, and they actually get a link to schedule a welcome Zoom call, which I believe you mentioned your daughter did. So we'll just hop on a Zoom with you and walk you through your portal, show you where to submit everything so that when the time comes, you'll know exactly, how to use it all.
It was great. It was so seamless and great and easy. We actually did our call together, our welcome call, and I was able to schedule it, I think like the 2 days after I logged in. It was just like, the whole thing was just so easy. And I have such epic frustration with insurance companies from all angles, as you can tell. And almost to the point where I was just going to choose no coverage and just, I was just going to be like, hey, I'm just going to raw dog it and see how it goes. Cause I was so frustrated with the whole system and the way that the government was subsidizing the policies for a while. And then that expired. And now people are paying this year. I'm sure you guys are getting flooded. I can't even believe what's happening with premiums right now. So this is just a really good, reasonable, sound, logical, the process is seamless. You guys have been nothing but helpful. Somebody gets back to me any question I have very quickly. So I've just been nothing but impressed. Last question that I have, and that I thought that it's not really a question, but I wanted to state this. You and I talked about this off air. Something that has come back from that blog post that I wrote on my Substack. I will make sure that's in the link so you guys can go read it. But something that came up several times was, well, aren't we legally obligated to have health insurance? Isn't that a federal law? And I did some digging and realized that it is not anymore. It was overturned in the first Trump administration. I think it was like 2017 or 2018. That's no longer a requirement. And yet I had no idea because nobody bothered to tell us. So a lot of us have been paying in and staying on policies simply because we did not want to get in trouble. But I don't know. Do you want to add to that?
Yeah, so they'll still ask you on your taxes if you have health insurance, but there's no penalty for when you check no. So it's just a question that exists, but the penalty actually is not enforced. There's only 5 states that do mandate health insurance. So there's New Jersey, California, Rhode Island, Massachusetts, and DC. So those are the states that will mandate it, which means that you will have a tax penalty based on your income. And there's usually a calculator that you can figure that out with. That being said, for the states that are on that list that we do enroll in, we still have members joining because even with the tax penalty plus our monthly contribution, it's still less than what their insurance premium was. And they don't have to worry about copays, their deductible, the network. So they're still enrolling from those states because it's actually still less for many people, which is, again, bananas to me.
Okay. And then what are the limitations? So I know if you're 65 or older, you mentioned that there might be some states where you guys are not enrolling? I just want to make sure.
There are states that we are not enrolling in. So if you're in Vermont, Pennsylvania, New York, Washington, Illinois, Maryland, California, and Oregon. Right now, we're not enrolling in those states. You can still go on our website and request pricing. And if you put in those states, we'll add you to a wait list. So if we do ever become available there, we'll absolutely reach out to you and let you know. And we're only available until you turn 65, because that's when Medicare kicks in. So that's when we would let you know that, your membership will be ending. You have to be at least 18 years old to have a membership as well. So we can't enroll a minor without at least one parent being on the membership. But there's basically 4 categories. You can either have an individual membership, you can have an individual and spouse membership, an individual with children, or a family, which is both parents and children. And regardless of how many children you have, the price is the same for a family or for an individual with children. So if you have 1 child or you have 10 children, the price is going to be the same. So as you add more children down the road, the price won't increase.
That's huge.
Yeah.
That's huge. That's awesome. I did not know that. See, I'm learning things. I love it. I love it. Well, is there anything that I missed that you want to make sure the audience knows?
Let's think about this. Yeah, I think that there's people who maybe have heard of health sharing before, right? And have maybe heard those horror stories. And I just want to say, for those people, we do things very different. We are not these legacy health shares that take months, if not years, to get back to you and reimburse you. We're really trying to change the industry, because when we started New Health, we saw a lot of issues in the industry. We saw these legacy health shares who have hundreds of thousands of members also bringing in hundreds of thousands of needs. And when you don't keep up with the growth of your health share, then you're not keeping up with the distribution of, the money to your members. So when we saw this happening in the industry, we decided we wanted to do it different. So instead of just trying to grow as fast as possible, we grow at a very calculated rate. So right now, we're only trying to grow 40% year over year. We don't want to go above it. We don't want to go below it, because we don't want those issues happening. And we've hit our goal every single month, every single year. There's a lot that we do on the back end to ensure that happens. But for example, we've never had a single month where the total needs that have been submitted from all of our members has ever exceeded that month's total contributions from our members. So it's another reason why we haven't raised our rates in a little over 8 years. And I think if you do have any concerns, just give us a call. We're more than happy to walk you through any questions or any concerns. And if you're someone who's never heard of health sharing and you want to hop on the bandwagon, again, if there's still questions or concerns that you have, just give us a call. I know it feels new and it feels different. I think that's what change feels like for a lot of people, but there's a lot of benefits to it. And I think it's saving people so much money and allowing them the financial freedom to do things that they weren't able to do before, like have a new career, take that vacation, pay for college. So the financial freedom that this allows people is just unbelievable, for sure.
Well, and the way the economy is right now, it's so critical that people be able to have some flexibility. I know that layoffs are rampant right now with a lot of the tech companies, and there's just so many things that can change. And I've seen firsthand what happens to middle-aged people when they get laid off, and either they sink or swim, and they will swim if they feel like they have the support they need, or even during COVID days, a lot of people chose to walk out on jobs because they chose not to participate in a mandate. And a lot of my followers, I have so many stories I could share with you, and people just did what they needed to do, what was right for them and their family. And health insurance keeps people tethered in a way. And it's very much a shackles kind of situation. I liken it to student loans. When you have a lot of student loans, like I did as a medical, student, I had medical loans. It traps you in a way. And so this is a bit of freedom that is, I can't explain it, but when you realize like what this health sharing can do, for people who really just feel like they have to stay stuck or they're in fear because maybe they did lose their job or they want to leave their job or whatever it is, there's options and they're really affordable options. And it's like really affordable. It reminded me of, I was like, oh, this is like 2010's pricing. When I logged in, I was like, sweet, sign me up. That's great.
Yeah, exactly. And it's funny because you mentioned entrepreneurs, but we also have a lot of retirees, right, who are wanting to leave their job and retire early, but they're not at the age yet where Medicare kicks in. So we've been seeing an increase in people in that age bracket because this is a great option for a lot of older, healthier people who are ready to retire and aren't just, they don't want to just keep their job just for the benefits. So that's another huge group that we see enrolling too.
I love it. I love it. Well, you guys have been so generous in providing a discount to my listeners.
Yes.
It's 20% off for the entire year. So if you guys go to New Health, that's KNEW Health, all one word, .com/share/Dr. and use the code Dr. Pod. Let them know you came from the podcast and you'll get 20% off for the year, which is awesome.
Absolutely. And you can use it on the website. If you call us, just mention you came from drtyna. We'll make sure that you get that code, that price. But yeah, we're really excited to welcome a lot of your listeners into the community.
Yes, I love it. I love it. And I really appreciate you making the time because I'll be honest, I signed up not really having any clue what it offered. I was just so pissed off at my health insurance company that I was like, I'm out. And, I've learned, like I said, I've had it for almost a year and I haven't needed to use it. I think it was August 1st when I became last year, 2025. But I've learned a lot over the past year. I've been in the portal multiple times and I'm very impressed with it. I think you guys are doing a great job. And I wanted to bring you on because I wanted to showcase this for my listeners.
This was fun. Thank you so much for having me.
Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.